Today we're going to share initial results on population health screening for advanced emphysema. We're part of Lung Health Program at Leahy Clinic, a Before Symptoms sponsored pilot site. I'm Ekaterina Vorovich. I'm a medical director for Leahy Lung Volume Reduction Program and associate program director for Leahy Interventional Pulmonary Fellowship. These are my disclosures. I'm a paid advisor for Before Symptoms. And we initially started this study. Our goals were to build a leading lung health program and provide early diagnosis and improve outcome for our community of patients. And we started with lung cancer, ILD, and COPD. Within COPD, we really strive to be recognized as center of excellence for advanced care, interventional, and surgical procedures. Our population screening pilot program would not be possible without our partners, Embio, a 4D medical company, and Before Symptoms. Embio provided us the clinical algorithm and imaging AI solution like lung density analysis for emphysema screening, including others UIP screening, CAC, and nodule analysis. And Before Symptom really was essential in designing, coordinating, and supporting our pilot clinic program, but also developing and implementing clinical pathway via navigation management. We chose to look retrospectively to see if there's any gaps in our own system. So we used healthcare system-wide CT imaging for 3 months, and we ran all the scans through AI screening algorithm from Embio. And we identified patients that fit into 2 pathways: advanced stage pathway that had low attenuation areas more than 40 and more than 50, and then the early stage pathways, really before the acquired symptoms, with more than 5% emphysema, was global low attenuation area. Patient navigation and coordination are the pillars of this program. As physicians, we're busy, and the program we develop includes resources to ensure there's no gaps in care. So our navigator and coordinator review every patient's case. They go over the list on the right to ensure that patients and providers are really reminded of the items that are essential for holistic lung health. I also want to stress, just because a patient doesn't meet advanced therapy criteria in a given year, they may qualify as their lung disease worsens in the next 2 to 3 years. And once they're enrolled in our program, we track patients to ensure that they're offered the best care. This flow diagram demonstrates our initial results for advanced emphysema pathway. About 2,800 CT scans were analyzed. 266 were identified to have advanced emphysema, about 9%. 160 were excluded after further clinical review, and 106 were ran through Olympus Select CT algorithm for bronchoscopic lung volume reduction. 59 scans met CT criteria for bronchoscopic lung volume reduction, and 47 were being assessed for surgical lung volume reduction. Out of the 106 patients that were identified with advanced emphysema, 8 were directly referred to our interventional pulmonary clinics for bronchoscopic or surgical lung volume reduction evaluation. 39 patients were referred to our advanced practitioner to be optimized prior to BLVR or LVRS evaluation. Additionally, we're able to identify important lung health clinical opportunities in this cohort. For example, as you can see here in this chart, 16 patients with advanced emphysema were not followed by a pulmonologist. About 20% of patients did not have pulmonary function tests in the last 5 years. 70% of patients were not screened for alpha-1 deficiency screening. And granted, this patient population might be older, but what about their children? What about the genetics, and how would that affect the next generations? Similarly goes for vaccination, smoking cessation, and important as for our healthcare system, the HCC documentation opportunity. Let's switch gears and talk about life before symptoms. These are the patients in our early stage emphysema pathway. We're able to identify about 100 patients with over 5% low attenuation areas on the CT chest that were being evaluated for referral for lung health clinic. 15% were really not followed by pulmonologists. 15 were still smoking. Half of the patients did not have vaccinations or that were up to date, and about 90% did not have screening for alpha-1 deficiency. Only 2 of these patients were younger than 50. This is the limitation of non-contrast scans, as they're not ordered in young patients. So we used NLP opportunistic screening for emphysema. We identified 1,200 patients that had screened positive for emphysema. 68 of these were less than 50 years of age, and after removing false positives and duplicates, we were able to identify 28 patients. As you can see here in this chart, based on age subgroups, patients were not followed by pulmonologists, about a third of these. They're also still smoking or vaping. And these are really lost opportunities from preventing these patients from really developing and going into the advanced stage emphysema later in life. Let's pause. This is a scan of the patient from previous cohort that was not referred to pulmonology. As you can see here, they're already developing subpleural blebs, and they're only 30 years of age, and they're still smoking. Where is this patient's, future pulmonologist? How can we help them now? So there's lost opportunities. So what does success look like to us? For our patients, it's really early diagnosis. We want to be better. We want to improve quality of life. We really want to close the gap, reduce underdiagnosis and under-referral, and standardize clinical management for these patients. And want to also give them access to care options and clinical trials. But there's also goals for healthcare system. You want to be recognized as center of excellence, improve your satisfaction score, grow your practice, improve your vaccination and smoking cessation rates, and reduce your COPD exacerbations. All of this could be achieved with emphysema screening program. We look forward to our 6-month results for advanced pathway in early 2025. And we also look forward to seeing the impact for lung health for COPD screening, smoking cessation rates, vaccination rates, and alpha-1 testing. Thank you.